I'd like to take this opportunity to thank Datamate, Hitachi, Axel for giving me this opportunity to speak on something that's very close to my heart. And I always get excited. If you ask my colleagues, some of them are here among you, the moment the automation, IT part of it comes, I get really carried away. So in the coming 15 minutes or so, just going to share a story, a success story of how Silverline Hospital became the first completely paperless hospital in Kerala. I'm just going to, all this has been covered exhaustingly in the last 2 or 3 talks. So I won't get into these things that have been already said. But let me just go straight to what we've done at Silverline Hospital, because I think ultimately that's what all of us need to know. In actual, what are we talking about? So I'm going to skip all this. We know all this. I'm sure everybody sitting in this room knows all this. Right. So this is how we do it at Silverline. Now this, if you ask me, has come into effect with a lot of, it was, if you ask me, I call it a trial and error method. The last 1 year that we've evolved, and we've made a lot of mistakes, and by no means have we perfected it as yet, but this is how we do it in Silverline. The patient comes in, basically he may have had a tele appointment. We also do it through the website sometimes. Or they walk in, they register, they compulsorily get their vitals done. We have a vitals corner. Get the vitals done. All this goes through the system. I'll just share that with you in a minute. And they go to a physician assistant, where the physician assistant works these cases up, essentially to reduce the load on doctors, essentially to reduce the waiting time. Then they come after the physician assistant is through, they key the data into the system. Then we, the consultants, see the doctor, decides what blood work needs to be done, goes to billing, from the billing goes to the phlebotomist, from the phlebotomist goes to the lab. At the lab, all the data is put into the system. As Joby said, we can sync it. We are in the process of syncing it, where the laboratory data is all gathered into the system automatically, and the laboratory in charge can just sign it off. It's no big deal. It just took us a while to find the suitable equipment. So right now, lab in charge enters these things manually, but soon we're going to automate the whole thing. And with the lab reports, we see the patient, and we write out a prescription, e-prescription, goes to the pharmacy, the patient goes home. I'll just show you in real how this happens. Yeah, so this is how it happens at our hospital. Patients come in, they get registered. Now what we're thinking of is we're also thinking of having like another monitor facing the patient, so whatever is being keyed in can be seen by the patient also. So if there are some mistakes, they can quickly tell us about addresses, date of birth, telephone numbers, etc., etc. But we don't use any papers, essentially because we are a paperless system where they have to enter everything, and then somebody takes it, reads it out, enters. It's all a duplication of tasks that we don't encourage that. So this is how the page looks like. The secretary sees this screen where the details are keyed in, and we also know once the details are keyed in, me sitting in my office, or my colleague, or anybody for that matter, knows how many people are waiting for us, their status, have they had their vitals checked, are they waiting for a pre-consult, and all those things we are able to see or map sitting in our offices. So for example, a classic thing is today, I knew how many of my patients had appointments, what time. So for example, at 11:30 I just realized that some of them had been waiting from 8 o'clock. So all of those information I can get. So we can speed it up. See, we are human beings. A lot of mistakes keep getting made. But it is also for doctors and also for people around us to realize that, and this is the only way that we can try and fix this problem. Otherwise, we do have like 50 people. Even the best of systems, we may not know who may be left out. And these things happen. Doctors, hospital administrators, you realize these things happen every day. So this is how we do it. Yeah, this is vitals area, as I told you. Vitals are taken. It's mandatory. All our patients, every visit, needs to go to the vitals area. Their weight, the first visit, their wasted ratio is also taken. Their blood pressure, everything gets heated, and automatically the body mass index comes on the screen when we do that. Then they go to a physician assistant. Basically, these are trained nurses who actually take the history down in a little more detail. So this is how it looks like. They enter the complaints and everything else, excepting the physical examination part. And after that's done, then they come to us. What we do is we then just make sure that they have the history in toto, and then we do a physical examination on them. Right, so this is basically what you're seeing on the screen is what DataMate has done for us. They've made a quick view for us. Means that, for example, if this patient is coming again, if it's a revisit, in one snapshot, we get the entire thing, including what the vitals have been in the past, weight, height, etc. All this comes in one view. So and even the labs, the chronology of the labs, how it has been done, and all that, and basically the medication the patient is on. So it's just one glance we are able to see the whole picture, and we're not missing things out in doing this. Then we kind of put the physical this one in, and then we order bloods, whatever needs to be ordered. After that, the patient goes to the laboratory room where the bloods are taken, and this is the billing for the bloods. Then the patient, obviously the sample goes to the lab and where it's analyzed. It's hidden. As I told you, we'd like to have it automated. It's going to be automated at any point now, because we are ready for it. Then they come to us with the labs, which is on the system. And what we do then is we show them. Actually, we're able to show them, for example, this is this gentleman's blood sugar there, which is shot up to 440. So we can show them graphically, see that this is the normal values that they should maintain. And they have been, this gentleman had been maintaining it, but all of a sudden shot up to 440. So just give them a schematic representation or idea as to what we're dealing with. And this is how we generate a prescription. It's all online. We generate a prescription, and we actually use a digital signature also. And then the patient goes to the pharmacy. We don't touch any paper, we don't touch pens. So much so that every time I go elsewhere, my ink pen, I never fill it, because I don't use pen at all. And then when I go in other place I go to, and the nurse is always laughing at me, how come, I am borrowing pens from them. And I say, please, sorry, this is what happens. Anyway, so the prescription gets relayed to the this one, and this is how the prescription looks like. As Joby mentioned, that there are no mistakes, spelling mistakes are not there. But what we need to watch out for is to make sure that the prescription is correct, which the pharmacist does for us. The pharmacist always looks at us. There is another level screen that goes on, and invariably once or twice in a day I get a call from a pharmacist saying that, Dr. Tom, you had actually last time there was something that you had written. Did you deliberately miss it out? Or is it by mistake? Sometimes it's deliberate, sometimes we may have mixed it up, or we may have overlooked it. So that way, we double check again. This is how the screen in front of the pharmacist will look like. And then they take the prescription and they go. They get everything printed out, put it in a nice order for it, and they go over that.